You know, I am so grateful to be a part of an organization that like this one, because we're an organization that is strong and that is important in our community, and we serve people in all kinds of settings. We serve people in settings like group homes and institutional large programs, workshop programs, that sort of thing for people with disabilities, developmental disabilities. We serve people who are in their own homes, who are learning to manage their lives a little better. We assist people through medications, through treatment, through detox programs. We interface with hospitals and other large providers and help people in the community. We really are an organization that's all about the people that we serve and the people who are their friends and family. People are best supported by the close circle of friends and family around them. And so our role is really to help people to get those relationships back together and to find the best path for them. Sometimes that path involves really extensive services. Sometimes that path involves a very brief interaction with us and then moving back to the life that they had before they came in contact with us. We want all those things to be possible for people. Healthcare is a really big issue in our country today. And Texas will see, just like other parts of the country, changes in health care. But those changes are actually changes that are likely to be very positive for us. We're likely to see more people who have an insurance card. We're likely to see more people who have choices in the providers that are available to them. We're likely to see more people who have more services that are community-based rather than hospital and large facility-based. It's really going to be healthcare of the future will probably put people more in touch with what they really need and find ways to give them services at earlier points in their lives rather than waiting until people have really significant needs. Healthcare is more than just about a medical condition. It's about all of the conditions that people have. And so we have played a role for over 40 years in helping address some of those unique kinds of healthcare needs that people have, like substance use disorders, psychiatric disorders, developmental disabilities, developmental delays in children. These are the kinds of services that we've provided and the kinds of services we'll continue to provide, because we're really all about making people's lives different and better and changing lives. We partner with the community, we partner with other community agencies, we partner with the individuals who receive our services and their families and friends, and we partner with our staff in the work that we do. I think it is so important that the people that we serve and the people that are in their lives have hope about the future. All of us want to believe that tomorrow is going to be at least as good and probably better than today is. And that is certainly true of the people that we serve, and our job is to ensure that that hope is met. You know, one of the things that is most distinctive about this agency and the services it provides is really the comprehensive nature of those services. Over this 40-year period, we have really worked in a diligent fashion to build our service system to be an evidence-based service system, to ensure that the services that we provide have a good basis in fact, and that we know that the services have a greater likelihood of being successful than not being successful. And so we work in a really comprehensive way. We've also had the opportunity over the years to be innovators, to be at the head of the line of implementing many, many service arrangements. And you see it throughout our service system, in areas in which we were the first organization, sometimes in Texas, to implement a service system innovation. We've been recognized by both state and federal agencies for our innovation here. All of those innovations ultimately benefit the staff and their opportunity to work in the kind of system that we are, but ultimately to benefit the people that we serve. We, like every agency, have transitioned over time. You know, when you think about the world that this organization started in 40 years ago, it was really a world that was very different. Over time, we've recognized that the types of disorders that we're talking about here in this agency are disorders that affect every family. You know, it's not a unique type of family that has the kinds of issues that our agency addresses. It's really every family. So we have become an organization that changed with the times, and the times changed with us.